Welcome, ladies and gentlemen, to the Heartland Daily Podcast. Today, we're going to be focusing on health as we do a couple of times each month. My name is AnneMarie Schieber. I'm the managing editor of Healthcare News. That is our newspaper that we mail to legislators, both at the state level and federal level, all parties each month. And joining me is Devon Herrick. He is a healthcare economist who is a policy advisor to us here at the Heartland Institute and posts quite frequently on the Goodman Institute Healthcare blog, which we invite you to check out because Devon writes about everything in healthcare and lots of good things to talk about. Although so much has been happening this week with President Trump's second administration, starting with the inauguration. And all the executive orders that came down on just the first day, some of them impacting healthcare. So I want to kind of explore some of those. But maybe first we start out with the inauguration. Devon, did you get a chance to listen to it? And what were your impressions of President Trump's speech?
Well, I think the general consensus is that on the one hand, he was trying to be inclusive, but he was going to do it his way, and he was, it was all about what his agenda. So it's kind of funny. It was a little bit of push and pull there. I want to be, inclusive, but it's going to be my way.
Yeah. No, I loved it. I thought it was a terrific speech. Loved the prayers at the end and the beginning, which kind of reaffirmed what he talked about. And he hit everything. I mean, none of it new for people who've been paying attention. Trump talked about a lot of these things incessantly on the campaign trail. There were no platitudes. And he played it straight. And I think a lot of Americans appreciated that. And they're all very excited. I read today that his poll numbers are through the roof, which is, not uncommon for a new administration. Everyone's excited.
Mm-hmm.
We're in the honeymoon phase. And Trump certainly didn't beat around the bush. I thought it was real interesting to watch the optics on stage. I don't know if you noticed that, but, we had the former presidents, including George Bush, and Obama was there, and the Clintons, and the Bidens. Kamala wore a black suit. Everyone was talking about the clothing up there, but I was just stunned by the glum faces that I was looking at on that side of the fence, and even from George Bush. Nobody was nodding their head and showing any smile through anything that Trump was mentioning. Did you notice that?
Well, what strikes me as very odd is they were all kind of dour, emotionless, and I've read more about Melania's hat than anything else.
Yeah. And then it was interesting, there was we had these tech titans all sitting in a row by the Trump family. That was notable. And ones who, we just never thought were on the same side of the fence as anybody promoting conservative ideas. And, Trump really doesn't fit that mold, really. He's more a populist president than anything, but he fits a lot of the conservative viewpoints. And I just thought that was really incredible. And of course, that whole thing played out with the tech titans. And we'll talk about that a little bit more later on artificial intelligence, which I think is really going to hit its stride in the next 4 years. And Trump kind of indicated that, right?
Well, yeah, and the tech titans really aren't conservative. They're just trying to buddy up because they know they really need to. They've been in the crosshairs of the Biden administration, not to mention the Europeans. So, they're all going to try, seek protection, seek friendship from President Trump simply because, it's kind of part of how they're trying to survive.
Yeah. Yeah. Well, let's dive in a little bit to the executive orders, and some of them having direct impact on health, but one of them kind of indirectly, which is the executive order on gender. So Trump said that no longer we're going to be using, at least in federal documents, the word gender. It's going to be male or female. We're going to be referring to sex, not gender. And, beyond the obvious, because, we've been talking ad nauseum over the last 4 years about trans treatments, states coming down hard on allowing these procedures, very risky experimental procedures on children, and whether insurance companies and Medicaid and Medicare should
Mhm.
be paying for this stuff. We don't know the long term implications. There have been numerous lawsuits. Um, I think, one of the things that really wasn't discussed was how gender, this ideology, was creeping into healthcare really through discrimination rules. So at the end, there was a rule applying to
Mhm.
doctors that said that they had to kind of validate a patient's desire for whatever sex they wanted to be referred to. And I think that was a really dangerous
Mhm.
step in healthcare because basically, how will we know? Medical science is based on science and not what somebody's thinking. There was a lawsuit, I think, emerging in Florida over this. And I think this was a really big step and a good one.
Well, and I think there's a couple things at work as far as the executive order. First off, he's sending a nod to his base saying there will be no more gender identity politics in my administration. But he's also sending a message to the entrenched bureaucracy that this is not going to be, part of the agenda, and don't try it, knock it off. If you're part of the bureaucracy for the last 4 years that has been trying to push a gender identity, gender, is a binomial. If you're trying to push an agenda through the bureaucracy of having it as a continuous variable with all different shades of
Yeah.
degrees, knock it off because my administration will not tolerate that.
Yeah. So we didn't hear anything really about this. This transgender demographic was kind of a micro, still is, I think, a micro minority. And we heard very, very little about it during Trump won. And it wasn't until the Biden administration stepped in and all of a sudden we had a
Mhm.
an explosion of people claiming that this was define them and that their rights needed to be respected and so forth. And there is an adage that says that politics follows the culture, but here I think we were using politics to control the culture because all of a sudden, we were seeing rainbow flags, LBGQ, everybody was talking about it. And then the next thing was insurance companies were having to pay for these procedures. And we just had never seen anything quite like that.
Well, I mean, years ago, after Obamacare was first passed, I had a reporter call me and say, "What does this mean?" And it's like, well, we don't really know because what proportion of people that identify as trans would want surgery? Well, and it was a big unknown for, how much to raise premiums to cover these extra costs. Well, as it turns out, we're talking more about it, but I don't know if I don't think there's been that much in terms of surgery and claims, but there's things like hormones and counseling that drive up the price of premiums for that. So I think it was just another issue to pull into identity politics.
Yeah. Well, what we did see was it being rapidly promoted, and it was big money, big business. And in fact, in Texas, where you're at,
Mhm.
it was banned, for children.
Mhm.
And now there's a lawsuit involving, or actually some action, legal action, against a couple of doctors who were caught ignoring that ban.
Mhm.
So I guess we'll see how that plays out. All right. Next on the list is the executive order ending the U.S. participation in the World Health Organization. Now, I guess this move was not so surprising. What are your thoughts, Devon?
No, he tried. I think Trump tried in was it 2020 or 2019, and of course Biden just reversed it when he got into office, and so it was expected. And part of the argument, I mean, the excuse used was, well, the WHO covered up some of the COVID information, but really it goes deeper than that. The WHO is very bureaucratic. It's not terribly efficient. Well, it's inefficient. Um, there's like what 193, 194 members, but yet the U.S. pays 20% of the budget, and many other wealthy countries just pay a fraction of that, obviously. And so a lot of people are tired of the U.S. being the cash cow of the world. And yeah, we can say the WHO does some good work in terms of public health in other countries, but there's no accountability, and I think that's the main issue.
I mean, this organization has been around since 1948. Can you think
Hmm.
of any notable achievement? Nobody really heard about it until COVID.
But they have, I want to say, 153 operations around the world, and in some cases it's things like monitoring Marburg virus in areas of Africa. In other cases, it's trying to catch the last few breakthrough cases of smallpox that was
Yeah.
supposedly eradicated years ago, and occasionally you'll hear about a polio outbreak, and they go in and try to hunt those down. But at the same time, it's a lot of money, a lot of bureaucracy, a lot of jobs, a lot of people, bureaucrats, public health bureaucrats making a good living without having a lot to show for it on U.S. taxpayers' dollar.
Right. And, a lot of people refer to this as the global deep state. And it's going to save US taxpayers, according to that Hill article,
Mhm.
$1.28 billion, dollars, a huge chunk of change. That's about 20% of the World Health Organization's budget. And, I'll tell you, this didn't get a whole lot of attention, but last year, the WHO was trying to get this pandemic treaty passed, and it kind of fell apart. But Biden was all in; he was ready to sign
Mhm.
it. And this thing would have been very intrusive. We had written about it, and I think everything was kind of dropped right after that May meeting in Switzerland, the WHO's annual meeting. A couple of, well, let's see, I think it was 20 states, US states, sent a letter saying to Biden saying, hey, this is not constitutional. We are not going to submit to global orders. And then I think the US senators chimed in. They wrote a letter
Mhm.
to Biden. The House actually introduced a bill. So I didn't realize this when Trump pulled out in 2020. Um, it was in July, and it didn't happen instantly because, according to
Mhm.
this 1948 Act of
Mhm.
Congress, they have a year to get out. And of course, Biden was elected at the end of that year and immediately revoked that order. So we were back into the WHO. Do
Mhm.
you think Congress needs to take some action? Because we're going to be up and down all over the map on this. And I guess as an agency, they would probably want some predictability as well, especially when the US is supplying 20% of its budget. So, do you think that Congress needs to act? That bill that the House introduced, I think it was September of last year, said that the Senate had to approve any sign on to a treaty such as the one that they
Mhm.
were considering. And that
Well,
went anywhere, but I guess we have to pick that up again.
think it makes a lot of sense for Congress and the Senate to vote on and approve treaties like that. I mean, we were paying, or still are paying, about 20% of the budget, and obviously there are entrenched bureaucracies and agendas within the WHO that are pursuing things that may not be something that U.S. taxpayers care about. I mean, of course, we all want to prevent the next pandemic. We don't want, Marburg virus or all kinds of things coming into the U.S., especially. But at the same time, we do want accountability. So I think Congress, it would be good for Congress to make some ground rules and to rewrite that treaty such that there is accountability.
Yeah. I think a lot of Americans would like to see, instead of seeing a blank check endorsement, which is
Mhm.
basically what that was,
Mhm.
we pay according to what pops up. I mean, if there is a huge need, I'm sure the US will step forward, as it always has, to
Mhm.
address an
Yeah.
emergency, whether it's in some third world country or right in our backyard. And, COVID, the reason Trump outlined, and he basically put out the same order he put out in 2020 in this executive order on Monday, but it outlined what was going on. So the WHO was very much controlled by China. We were supposed to
Mhm.
investigate the origins of the COVID-19 virus, and they were going to take, who was it, the Surgeon General at the time, Guyer, and he was going to be one of the investigators, and then the WHO pulled out on him, and then they put Peter Daszak in, who basically was a very biased person.
Mhm.
And that was something that came down even last week. I don't know if you want to talk about that. So this organization called EcoHealth was the one that was doing the research and funneling US tax dollars, even
Mhm.
though gain of function research was banned. And in 2016, President Obama outlawed it, but still money was going to this lab in Wuhan to do this research. And so last week, HHS, the Department of Health and Human Services, disbarred EcoHealth and Peter Daszak from ever getting money again.
Mhm.
And I think that investigation is not quite over. Then we had the Fauci pardon. Fauci hasn't been charged with anything, and Biden pardoned him at the last minute. What do you think this? Are we going to hear the end of this, or now that we have a completely new administration, new leadership in the House and the Senate, are we going to get to the bottom of what happened? I think a lot of people would like to move on. It seems so long ago, 4 years ago, but we still have not learned everything we need to know, and so we don't repeat those mistakes again.
Oh, that's hard to say. I think a lot of people really have moved on, and it was a it was a rough period for a lot of people who were out of work and relying on stimulus money or landlords who weren't getting paid. I mean, there was a lot of stress and uncertainty, and so I think at this point, a lot of Americans really are ready to move on and not
Yeah.
talk about it anymore. But at the same time, there are questions that we would like, that we could use answers to know it won't happen again.
Yeah.
But there's always a risk, in my opinion, whenever you are doing joint research with China, because they're going to take every advantage. They're going to use stuff to their own designs, and I mean, we don't know what they were using that research for, and it's just a lot of uncertainty that I would be very hesitant to want to fund in cooperation with China.
Well, I think we need to probably work a little bit more on what went on with the vaccine. And I know that's probably a touchy area for Trump because he was very much in support of getting those vaccines out
Mhm.
for the COVID shots. And, they weren't thoroughly tested. And we learned many unanticipated side effects from those shots. And there aren't lawsuits because they were protected, the vaccine makers. It was Those vaccines came out and they were protected from lawsuits under emergency use
Mhm.
authorization. I don't know if you're aware of this, but there's a contest, $1 million. It's going to be a debate, and it's Steve Kirsch who is sponsoring this, and they're going to do it this year. He finally got a taker. We wrote about this in Healthcare News, but what someone had suggested is, if perhaps, the debate is, did the COVID shots save more lives or cost more lives? So I forget the name of the root I forget the name of it's a platform for debates, and the guy who owns it,
Mhm.
he's from Israel. He has taken up this offer, and they're going to take about a year, and they're going to be judges. But what's interesting is someone had suggested if they could possibly show that there was some lying going on to get that EUA, and that the shots really weren't vaccines that should be protected under the law. Reagan gave vaccine makers indemnity, for developing
Mhm.
vaccines. And if somehow or another information comes through this debate that those vaccines or those shots were not really vaccines, but immune therapy, or, something other than what we thought, perhaps that immunity will be lifted. I don't know. But I kind of think nobody puts up $1 million for nothing. There's
Well,
a reason for this.
what's interesting was there were a pair of researchers from Texas that had been working on a vaccine, an old-fashioned traditional style vaccine for another respiratory illness that I think struck the Middle East, I don't know, 7 or 8 years ago. And so they had a head start. And so when COVID came around, they told HHS, hey, this is very similar to the work we're already doing.
Mm,
And we could easily modify this and we can have a vaccine in, you know, months. And nobody wanted them. Nobody cared. Nobody was interested because you had, Pfizer and all the others. They said, no, we can do the, you know, the, you know, the genetic messenger vaccines. And so they in fact had to get private donations, and it was used, actually sold to India. And my wife used to work for the FDA years ago, and she's like, the old technology has been proven for generations. Why would you turn down something that has worked for generations and go with something brand new that's risky?
yeah.
So that's
Well, mRNA is a riskier kind of technology for vaccines. It's a made up vaccine, a virus, right? Based on
mhm.
genetic codes and whatever. And, I guess we don't fully understand. Boy, I'll tell you, right after the inauguration, Larry Ellison ruffled a lot of feathers when he talked about using artificial intelligence to design vaccines, and in particular, design a vaccine that would eradicate or prevent cancer. And Robert Malone, that name came up again, and he wrote about this and said, "This is crazy. Cancer is so complex that we can't
Mhm.
possibly come up with a one size fits all vaccine to stop cancer." And I don't know what he was insinuating, but he was up on the stage and all those big tech type. The only one who wasn't up on the stage was Bill Gates. Did you find that interesting? He's the one who's
Well,
really behind all the vaccine stuff.
yeah, it's I don't know if he has issued any kind of press release about why or where he was or why he wasn't there, or maybe it was just it could have been a variety of reasons, but it it does raise some questions. If all the other tech titans were there and part of his mission through his philanthropy is vaccines, it makes you kind of wonder.
Right. Right. Um, all right. So another executive order that came down is that Trump has ordered all the federal health agencies, the CDC, the FDA, the NIH, from issuing any statements. No corporate media, or actually, well, the corporate
Mhm.
media is beside itself. Maybe we can pull up some of those doomsday articles. There's one there, federal health agencies. I don't know, Andy, if you can pull that up. But of course, they are saying that this is all about censorship now. And this is just Trump kind of getting everything online. Jay Bhattacharya is in charge of NIH. And if there's anybody who understands the devastation of censorship, it's him. And I don't think, yeah, Trump tells health agencies, stop talking to the public. Now, I'll tell you, when under the Biden administration, I would go on to the CDC's website quite a bit, and it was more than just announcing public health information. It was things on, fat shaming and gender ideology and DEI and equity and healthcare. It was all very much ideological stuff, nothing really having to do with healthcare. And I think probably this was just a precautionary measure until they kind of figure out what's going on. We don't have those nominees confirmed yet, right? Kennedy and HHS, or Bhattacharya, or Martin Macri at FDA. So I guess that is probably to be expected. It's not forever. Trump said
Mhm.
it's probably going to be until the first week of
Well, and
February.
that's what I read was
Yeah,
that it's not uncommon for an administration to, the first day in office to tell everybody, keep quiet until we can get our ducks in a row and the right people are in charge. You don't want, the career bureaucrats to be setting policy. You want the appointee to be there to approve communications. I mean,
Right.
the FDA issues stuff like all the time. I mean, if a company had a warning letter, well, that's released to the public. You can read that online, or you can at least find out about there being a warning letter. I mean, if I'm always seeing notices from the FDA about a given dietary supplement containing an actual drug, and be warned, don't take this, it's dangerous. But, but
Yeah.
yeah, it's just Jimper. It's not even uncommon. It's actually pretty typical and pretty standard, especially when there's continuity, not continuity in the
Yeah.
cabinet to say, okay, everybody, you know, don't be releasing communications until your boss is installed.
Right. Yes. And I think in particular, the CDC, which had so much
Hmm.
influence over the media and over local public health agencies and companies, everybody kind of fell in line. And this was so much what the deep state is all about. It's unelected people who are dictating policy right and left. And everybody was terrified of this agency. Remember, at one point, they were the ones who ordered masks on airplanes because they had that
Hmm.
authority until it was thrown out in court. So they can be a pretty dangerous force to be reckoned with. And, we're hearing little grumbling or little comments about this bird flu stuff. And
Hmm.
I don't know whether that was in the back of their minds that they didn't want this to get out of hand. I guess China is having a tough time with bird flu, and that's kind of how COVID started. So there is a little concern there.
But check the price of eggs. I mean, there's something going on.
Yeah. I want to talk about now artificial intelligence. So, as we mentioned, those tech titans were all up there in full display at the inauguration, and they very much have their eyes on this in this new technology, AI. And um, I want to talk a couple of things. We talked about Larry Ellison, this thing called Stargate, which is a private public partnership to develop artificial intelligence. And it's probably going to emerge and somehow find its way into healthcare.
Hmm.
And then we had, Larry Ellison at that, he's there in the middle in that photo, make those comments about cancer vaccines. And to me, I think, this is really alarming because artificial intelligence is still quite a big unknown. We don't know how it's going to be used and whether it's going to be used properly. You wrote about this, and we want to talk a little bit about your post on this and healthcare.
Well, artificial intelligence at its most basic level is an algorithm. And what is intelligent about it is it can learn from, over time from various corrections. I mean, we've had algorithms for years, of course. It's what separates, artificial intelligence is over time, it theoretically becomes more accurate and more accurate because you are continually giving it more information, correcting it, pulling out bad information. But what I had never anticipated until I read an article about it was that unless it's monitored carefully, it can degrade over time.
Mm,
It's just like, you and I, we go to school, and then we, on the summertime, as kids, I say kids lose something like a third of what they learned during the previous year over the summer. Well, apparently AI can do that as well. And I think that a lot of it, what it is just bad data. If it's only as smart as the data you plug into it and you train it with. And if it gets bad data, it's very, very difficult to unlearn because you can't track it down. Apparently, it's hard to
right.
chase
Well,
down. Which data set is erroneous.
yeah. I mean, I would be very concerned about bad actors somehow
Hmm.
manipulating data that could influence AI. And to me, this is healthcare. This is dealing with life and death. And so much of medicine and healthcare is an art. It's more than, it's not just a science. We already know, protocols and what to do for certain diseases and illnesses, whatever. But so many times having a face to face interaction with a physician who knows you, every human is different. I don't know that AI could ever replace that. It's certainly not going to replace doctors. And I would hate to think that we definitely have a doctor shortage in this country for so many reasons. And I would hate to think that this is kind of a cheap way out or a way to fix that problem, because we still need human interaction in healthcare if we're going to get good healthcare.
Well, I think it'll never replace your doctor, but it might help your doctor. It might assist your doctor. It might allow your doctor to treat more patients than he or she was treating before. I mean, for example, a mammogram. It used to be that just to be on the safe side, you might have two different radiologists read a mammogram. Well, now if you get a mammogram, it was probably scanned initially by a type of algorithm that looked for certain things, and then it, of course, highlights. The radiologist does, his or her own review, and then compares notes to see if there's something that the algorithm picked up that maybe the radiologist didn't notice, or maybe the radiologist noticed something that the algorithm didn't pick up. And that's how you can train AI to pick up certain things. So I think there is a lot of AI in healthcare, and there will be a lot more over time.
Yeah.
It's just they haven't really figured out all the different areas where they can use it. And
Yeah.
if there's a mechanism, for example, I used a telemedicine service, I don't know, last year. You went online, you filled out a little form, and it was sent to a doctor that reviewed the form. They approved it. They shipped out a drug. That was the most basic form of telemedicine. I never talked to anyone. I just put information on a website. And I can envision AI having something like that where instead of just typing in stuff on a website, maybe it's a large language model that you can dictate, or maybe you type it in and it gets an opinion, which it then sends to the doctor who reviews it and approves it or says yes or no, or we need more information. So I think there's a lot of potential, but
Mhm.
it'll take time to figure out what that potential is and where it's appropriate and where it's not really appropriate.
Oh, I totally agree. And I think that maybe in drug development, especially because look at how much money and time it
Mhm.
takes to get a drug to market. And perhaps AI could be used to speed up that process and save some of the money and get these drugs out there more quickly than we are doing today. I mean, I just think that we have to proceed with caution, like with any new
Mhm.
technology. Like, I said, medicine is just as much an art as it is a science. But, we certainly should develop it. And, the US is a leader in this technology, and we're considered kind of the leaders still in healthcare. And so I think really if we get everybody on board and we set up some safeguards, that this could really be used to our advantage.
But one of the examples I read about was, how can AI create a problem? Well, in one case, they asked an AI model the same question time out repeatedly, and they kept getting a different answer. Well, that shouldn't happen. But on the other hand, if you get the model right and it helps your doctor treat three times more people more effectively and with fewer misdiagnoses,
Yeah.
that's what we're looking for.
Yeah. I mean, I can tell you can go into chat. What is it? I don't even use it, but you can have AI write a paper for you or an article. And I can tell somebody had submitted to me an article that was generated by AI and I didn't like it at all. I mean, there's just so much human interpretation in there, and it's not going to be custom fitted to what you might be looking
Mhm.
for. I mean, I find it helpful on the real nitty bitty tech stuff, like where, you're looking for a missing comma or a period, the grammar AI that's used. I think that's very helpful. But to actually submit and write content might be a little more difficult. Now, there is so much content on the internet, and
Mhm.
I can't imagine that all these providers of that content are cranking it out as quickly as we think they are. I think they do get a lot of help from AI, but again, I think there's a lot of oversight. What are we looking at here? Oh, goodness, yes. This is yeah, this is medical imaging. Is this AI? Yeah.
So this is,
Um,
I pulled up ChatGPT and I asked it, how can AI cure cancer? I thought it'd be interesting.
he
So
has an answer.
it failed halfway through to give you your answer.
Yeah, who needs doctors, right? Well, this has been a great discussion. We'll see next week if it's going to be as jam-packed in the next couple of weeks as this first week. I think things will probably slow down a little bit, and we'll digest what has happened and have the fallout from everything. We'll probably have the confirmations done by then, and certainly much more to talk about. But I think for the most part, many people are excited in healthcare. Chip Roy wrote a really good piece this week in Daily Signal that I'm going to reprint in Healthcare News about what we need to do in healthcare. And maybe, like we said, we talked about this last time, Obamacare. Maybe what we're looking at is a new opportunity to kind of fix and work out some of the problems with delivery of healthcare. So maybe we'll talk about that next time.
Sure.
Devon, thank you for joining us. And as always, thank you for tuning in, and do give us a thumbs up if you like this content. And we hope that you'll join us again and take a look at healthcare news, because we do try to cover as much going on from a free market perspective. I don't know that you're going to find that in much of the corporate media publications, but we will be out there doing that every day. So thanks again, and we'll see you next time.